Today we're going to go over an exercise specifically for people that have disc herniations. How's it going, everyone? I'm Dr. Henry. I'm a sports chiropractor here in Vancouver, Washington, and today we're going to go over this exercise, and it's referred to as a foraminal opening exercise. And grab my spine here. So we're going to go through this pretty broad. This isn't like a disc herniation class, but I'm going to kind of show you the mechanics of why this is helpful, and hopefully that kind of helps you like conceptualize a little bit. You can kind of understand what we're about to do here. So the problem with a disc herniation is that herniated material pushes out of the disc and it can hit what's called a nerve root in your low back, and that nerve root also comes out of a hole in the side of your spine referred to as a foramen. And so we're going to try to open up that hole a little bit with this exercise and kind of stretch a little bit in a certain direction, opening that hole, and that can hopefully kind of take some of the pressure off of that area and maybe relieve your symptoms a little bit. I'm being totally broad about this. I hope that helps you out a little bit. I'm not going to get detailed into it, but let's check this guy out and hopefully helps you out a little bit. Let's go. All right, guys, so what we're going to do is I'm going to show you on the spine here. We're going to basically try to position ourselves, and if you're at home, you obviously don't use a chiropractic table. You can use like a couch or your bed or whatever, and we can basically, our goal is to kind of drop this pelvis a little bit and laterally flex that low back so that it opens up the openings. So if you're having pain, the painful side would be up, the non-painful side would be down. I'll do it on myself. Here's what it looks like. All right, guys, so I'm going to basically lay on my side, and I'm going to bring my knees up to about 90 degrees. And then what I'm going to do is I'm going to swing my legs off, and I'm going to let these guys freely just drop to the ground. And that's going to kind of help pull my pelvis down this way and laterally flex my low back. Now, if you're at home, you can always use like a pillow or something underneath those ribs to kind of elevate them, get them up a little bit more if you'd like to. But then you just totally relax, and you hold this position for like a minute. You can hold up to 2 minutes here, and then you can repeat if you need to. All right, guys, I hope this helps you out a little bit. I highly recommend working with a healthcare professional to help you set this up, especially if you're having an active disc herniation. It can be really painful, and there's some little tricks that you can do here to kind of help you modify this to make it work for you. I love incorporating this stuff in my practice because I love seeing people get better with like chiropractic adjusting, manual therapy, doing all those things that I do in the office. But these are the types of things that I use to kind of send people home with so that they've got some tools to use at home to get them feeling better and back to being active. All right, guys, be sure to let me know if you have any questions. I hope this helps you out a little bit.